the show as it goes on. Ladies and gentlemen, folks, we have with us here Dr. Mccanne, Health Policy Fellow. Dr. Mccanne is a family physician in San Clemente, California. For 3 decades, Dr. Mccanne has allotted one half of his practice hours to indigent patients. He has been cited by the San Clemente City Council as being outspoken, especially when it involves the elderly and underprivileged, because he believes that the ability to pay should not be the major criteria for receiving health care. Dr. Mccanne, good evening. How are you?
Good evening.
Well, doctor, a very distraught and disturbing story that occurred the last 24 hours. As you know, a husband, financially desperate because of his wife's medical problems, walked her to the balcony of their fourth-floor Kansas City apartment, kissed her, and then threw her to her death, according to court documents filed Wednesday. Stanley Raymer, 51, was charged Wednesday with second-degree murder for allegedly killing Christy Raymer, 47. Her body was found Tuesday night on the pavement outside the Plaza Point Apartments in that city. Her medical bills ranged from $700 to $800 a week, and she had no health insurance, according to probate court records. And this is where we really want to start off, doctor. No health insurance. An American citizen that does not have health insurance, that's my first question, really. What does one do without health insurance that needs health care?
Well, of course, they make do. And sometimes it does result in desperation, such as this very tragic story. Undoubtedly, there were more issues. She was very, very sick, and I think he also was caught up with the grief of seeing his wife continuing to suffer. But this burden, financial burden that was placed on them in the face of her terrible medical problems, obviously overwhelmed him to cause him to commit this desperate act. You know, I send out a quote of the day through PNHP, Physicians for a National Health Program. And by coincidence, I happened to pick this story as today's quote. And when I went to the internet to try to get some of the details on it, I was astounded to see the number of resources in foreign countries that picked up this story. Many, many different foreign nations picked up this story, and those nations are astounded that the United States, in the face of horrendous medical problems, subjects people to medical debt and even bankruptcy. No other nation does that. I mean, talk about insane. And then to lead to this terrible act of desperation. I mean, we can do far better than that in the United States.
Dr. Mccanne, it gets even worse. Well, I mean, any worse than that, I guess it can't get. But as a matter of speaking, here's another something to add to this story. And this even surprised me when I read about it, because I had no idea what was going on. Elders that require health care needs, such as caretakers to take care of them, to help them at home, or let's say elders that they come to the age where they can no longer take care of themselves and find that they cannot afford to hire somebody, are going to Mexico to do this. For $1,300 a month, a quarter of what an average nursing home costs in, let's say, Oregon, some people get a studio apartment, 3 meals a day, laundry and cleaning service, and 24-hour care from an attentive staff, many who speak English. She wakes up every morning next to a glimmering mountain lake, and the average annual high temperature is about 79 degrees. It's a paradise there, doctor. And I don't understand how here in the United States, with all the resources that we have, that we can't offer the same thing for our senior citizens. Why not?
Of course, we're This year, we're already spending $2.2 trillion on healthcare, and a lot of microsimulations and other studies have shown that that's more than enough money to provide the highest quality, most comprehensive care for absolutely everyone if we would just establish a system of allocating those funds more effectively. And of course, what we think we need to do is to establish a national health insurance program, a program like Medicare, except fix it so it works better than Medicare, would cover things such as the long-term care, and then provide that for everyone. We have the money, we just need the political will to do that.